Hi there, I'm Lowen Naturopath at the Hypothyroid Natural Health Centre. I'd like to take a few minutes to discuss underactive thyroid conditions that may also be referred to as hypothyroidism or Hashimoto's thyroiditis. Most cases of autoimmune thyroid disease will start out as a deficiency, specifically a lack of iodide in the diet. When the body tries to deal with the deficiency, the response can lead to an autoimmune condition. Let's look at how this happens. The thyroid gland makes thyroid hormone under the instruction of the pituitary gland in the brain. The pituitary sends a signal to the thyroid gland in the form of thyroid stimulating hormone, or TSH, to tell the thyroid gland the body needs more thyroid hormone. Within the thyroid gland are cells that take in iodide, where an enzyme called thyroid peroxidase converts it to iodine. Iodine can then be bound to tyrosine, which is an amino acid, to make the thyroid hormones. T4 is 1 tyrosine and 4 iodine atoms, and T3 is 1 tyrosine and 3 iodine atoms. If you have a deficiency of iodide, your brain cannot tell you to go down to the sea and catch some fish or chew on some seaweed. All it can do is increase production of thyroid peroxidase and try to convert more iodide to iodine. In large numbers, this enzyme can begin to damage the thyroid gland. The thyroid peroxidase can leak out into the blood, where the immune system responds by making antibodies. The antibodies will remove thyroid peroxidase from the blood, but they can also enter the thyroid gland and create inflammation and damage. At this point, patients are usually diagnosed with an autoimmune condition like Hashimoto's and given thyroid hormone replacement like thyroxine or Utroxic. Now the pituitary thinks there's enough thyroid hormone, so it slows production of thyroid stimulating hormone, and the body will respond by lowering thyroid peroxidase and thyroid peroxidase antibodies. Of course, the best time to act is when you are at the deficiency stage. We would see thyroid stimulating hormone on a blood test is elevated above normal, but there are no antibodies present. T4 levels would also expected to be low. Patients will tell me the doctor thinks they may have a thyroid problem and wants to wait and see. If you wait long enough, it might just become an autoimmune condition. But if we treat the deficiencies with nutrients like iodide, vitamin A, selenium, zinc and iron, hormone levels should return to normal. Patients usually consult me when the medication is not having a good effect and they still have their symptoms, or they want to know if there is an alternative to taking the medication, or they may want to know if they have to stay on the medication forever. If the medication is not having a good effect, we can use nutritional supplements to help the drug to be better utilised by the body. I would also look for underlying reasons for their symptoms, as it may not just be a fault of the medication. Is there an alternative to the medication? Yes. We can use herbal and nutritional medicines to lower the thyroid antibodies and support the thyroid gland to return to normal function. We can also use herbal medicine to rebalance the immune system. Remember, it probably started as a nutritional deficiency. Do they have to stay on the thyroxine or Utroxic forever? This may depend on how long they have been on the medication and if the thyroid gland will respond and begin to produce thyroid hormone again. It also depends on whether or not it was an autoimmune condition in the first place. If you would like to contact me, I will be happy to discuss your case with you. You will find more information on my website, naturalfamilymedicine.com.au, where you'll also find my contact details.